evening, everyone. I'm excited to be here tonight to present the ways in which motivation can be harnessed to support change in the context of chronic pain. Before we jump in, a little info about me. I'm here in the US. This is the third country I've lived in, as I was born in England and subsequently immigrated to Canada, where I grew up. Last year, I completed my PhD in clinical psychology at McGill University in Montreal, Canada. My dissertation research focused on the role of autonomous motivation in the process of goal pursuit and clinical symptom development in perfectionists. I was subsequently fortunate to come to Stanford, where I'm currently a clinical fellow within the pain management department. My clinical experiences have ranged widely, but I have special interests in chronic pain and psychosocial oncology. So let's start here with what I hope is a belief that we all share, the notion that everyone has the capacity for beneficial change. However, I'm going to go out on a limb here and also assume that we're keenly aware of how challenging this can be, especially when coping with the significant life change, chronic stressors, and the associated distress. I'm really passionate about the models and tools I'll be discussing tonight because I truly believe they can support this capacity and improve the ease with which change can occur. Before we can dive into harnessing motivation, we have to know what we're striving for. This is where goals and the process of goal setting come in. Personal goals have been defined as mental representations of desired outcomes. Personal goals focus and guide our behavior. They require individuals to mobilize their energy, demonstrate persistence, utilize their skills, and also regulate themselves. Personal goal pursuit has been suggested to have the potential to foster a number of positive changes and is believed to contribute to successful development over the life course. In other words, having goals, our desired outcomes, is really important. Once we've set these goals, we need to engage in action or change in order to move towards them. This is where motivation comes in. Motivation is our urge to think, act, or engage in a certain way in order to achieve a goal or fulfill a desire or meet an expectation. You'll notice from this definition that motivation is not only key in goal achievement, but also plays a role in our movement towards desires and even the expectations of others. So motivation is the process that initiates, guides, and maintains goal-oriented behaviors. It's what causes you to act, whether it's getting a glass of water to reduce thirst or reading a book to gain knowledge. Motivation involves the biological, emotional, social, and cognitive forces that activate behavior. Given that goal setting and goal achievement have been identified as valuable in optimal functioning, and the fact that motivation is what moves us towards our goals, motivation is critical. It's a key component in the process of change. If we learn to harness our motivation, we experience increased ability to achieve valued outcomes. This includes things like improving our day-to-day functioning, something as simple as making our bed each morning, or even things as large and abstract as finding a sense of purpose. Learning about motivation is valuable because it helps us understand where motivation comes from, why it changes, what increases and decreases it, what aspects of it can and cannot be changed, and it helps us answer the question of why some types of motivation seem to be more beneficial than others. Motivation is really the pathway to changing our way of thinking, feeling, and behaving, so it really deserves our attention. Now, let's add in chronic pain. So pain itself has been defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Whereas chronic pain is defined as pain that persists or recurs for longer than 3 months and is associated with significant emotional distress or functional disability. As many of you know firsthand, living with chronic pain is very challenging. The impact of chronic pain is significant. Chronic pain can cause a significant disruption to daily life. Common impacts that we observe are low mood, poorer sleep, reduce social engagement, and decrease functioning, which leads to deconditioning. Together, this makes carrying out daily activities exponentially harder. Research and clinical experience also suggests that it tends to decrease motivation. While this tendency evolved because of its value when experiencing acute pain, for example, reducing movement when you've sprained your ankle, it's quite problematic in chronic pain. The good news is that this is changeable. Motivation can be influenced by your environment, skills, knowledge, and your ideas about pain. We'd be in trouble if that wasn't the case, because patients facing chronic conditions must often make changes on many levels. Behaviorally, they may need to reduce their caffeine intake, alter their diet, or engage in daily exercise. Emotionally, they may need to come to terms with the reality of their condition and its impact and learn to regulate their emotions in the face of pain. Cognitively, they may need to engage in a change process with regards to their tendency to engage in catastrophizing, or they might need to learn to shift their cognitions about their ability to cope with pain. As a patient, it might feel like you're being asked to undergo your own metamorphosis, all while feeling like all of your motivation has disappeared and hopelessness has taken hold. That's really hard. It's also really important, though, to address, because as we know, there are many changes, such as those just listed, that can be extremely beneficial in managing the pain experience. As I said earlier, change is challenging in general, but even more so when experiencing chronic pain. The experience of persistent pain decreases our ability to adapt. It can interfere with our level of flexibility, and most importantly, rob us of our inner motivation. It's important to note, though, that while challenging, it does remain possible. And we see that those individuals who engage in adaptive pain coping behavior and they cause these changes experience significant benefit. The change process is constantly in flux. How ready you are now does not indicate how ready you will be next week or even tomorrow. So you're probably asking yourself this question now. If you buy into this idea that engaging in change to manage pain is important, and you understand that motivation is a key ingredient in change, then you might want to know how exactly we can motivate change. The rest of today's talk is going to highlight the core principles of harnessing motivation and prompting change. I'm going to touch first on the role of awareness, the importance of good quality motivation, and a model of change called the trans-theoretical model of change, before providing you with 3 quick tips for getting in touch with your motivation and engaging in change. The first step is building awareness. What I mean when I say awareness is the process of making the unconscious conscious, exploring and understanding more fully the factors at play. This happens to be one of the most valuable and widely used change prompters. Most psychotherapies, ranging from CBT to ACT to psychoanalysis, all begin by trying to increase your level of awareness and therefore, in turn, increase the amount of information available to you, which tends to prompt adaptive decision-making, motivation, and change. Awareness is key. The first step in fostering change is to become aware of the things that are getting in our way. In this circumstance, knowledge of ourselves, knowledge of the obstacles really is power. We're going to come back to this piece as it really is key, and I'll be sharing a number of questions you can ask yourself to enhance awareness and in turn foster change. Now, autonomous motivation. So I'm sure you've all had doctors list off why you should change, tell you the benefits, and provide lots of advice. But despite that, you might find yourself struggling to actually make the change. You might even notice that the more someone tries to convince you, the more resistant you feel. This is your need for autonomy trying to grab your attention. It is difficult, if not impossible, to force people to change. It's important for you to deeply understand your own goals, obstacles, and strengths in order to self-motivate towards change by harnessing the magic of autonomous motivation, Only you can decide to change. And we found that internally motivated change is also most sustainable. So, what exactly is autonomous motivation and why is it so powerful? Well, motivation is understood as occurring across a continuum from highly controlled to highly autonomous. Autonomous motivation is synthesized with the self and reflects goal pursuit founded in inherent interest, values, and enjoyment. In contrast, controlled motivation is driven by internal and external pressures and reveals compelled engagement in goal pursuit. Put simply, autonomous motivation can be thought of as want to motivation, while controlled motivation is more so have to motivation. Of note, we do see a tendency in chronic pain to move towards only engaging in the have tos given limited energy, low mood, and poor functioning. So we do tend to see this movement towards more controlled motivation rather than autonomous motivation. Again, highlighting why it's so important to understand autonomous motivation and recognize the ways in which we can foster it, which is what we'll be doing as we move through today. So, there's a significant body of research that has demonstrated the advantages of autonomous motivation in the process of goal pursuit, whether you're learning to play the piano or learning to find fulfillment in life despite the presence of pain. Specifically, autonomous motivation has been associated to bolstered goal progress, increased effort, less internal conflict regarding goal pursuance, and increased readiness to change. In addition, autonomous motivation has been identified as an important predictor of well-being. Overall, individuals are more satisfied and successful when they can engage in an internally regulated goal pursuit rather than according to a strict external system of regulation. As I was alluding to earlier, chronic pain can take on the role of this external regulation system. Therefore, reconnecting to autonomous motivation is key to reaping the aforementioned benefits. This model, the trans-theoretical model, also called the stages of change model, is helpful in doing just that. This model was developed through studies examining the comparative experiences of smokers who quit on their own with those who required further support in an effort to understand why some people are capable of making behavioral change on their own, while others seem to struggle. In the end, what they determined is actually pretty intuitive. People seem to quit smoking if they were ready to do so. Based off of this finding, the trans-theoretical model focuses on the decision-making power of the individual and is a model of intentional change. This ties very closely with the notion of autonomous motivation. The trans-theoretical model of change assumes that an individual's motivation for change is a major component of making change. It also believes that people differ to the extent that they are ready to engage in behavior change. I think this third assumption is really important. The fact that we can be well informed of the health benefits of change, but still lack true motivation to change. This model is wonderful because it allows us to directly work on that ambivalence with regards to health behavior change. This model, the trans-theoretical model of change, is really valuable to understand and implement because it helps us to determine a change plan, helps us connect to autonomous motivation, and maximizes our chance of success. So the model posits that individuals move through 6 stages of change. First, pre-contemplation, then contemplation, preparation, action, maintenance, and termination. I've left off termination in this depiction as it's not part of the original model and it's actually less often used in the application of this model to health-related behavior change. What we know is that for each stage of change, different strategies are most effective at helping a person move to the next stage of change and subsequently through the model to maintenance, the ideal stage of behavior. We're going to discuss what strategies you'll want to incorporate in each stage in the next few slides. Of note, reminding us of the cyclical nature of the model, we do see the downward arrow representing progress, while the upward arrow denotes relapse to earlier stages, sort of negative movement, less engagement in the change itself. This movement forward and backward through the stages, it's considered normative when engaging in difficult behavioral changes. So let me briefly walk you through how we conceptualize each stage. So this is a busy slide. We're going to go through it slowly. So first off, we have pre-contemplation. In this stage, people do not intend to take action in the foreseeable future. In this model, that's defined as within the next 6 months. People who are in pre-contemplation are often unaware that their behavior is problematic or produces negative consequences. They often underestimate the pros of changing behavior and place too much emphasis on the cons of changing behavior. Next, contemplation. In this stage, people are intending to start the healthy behavior in the foreseeable future. Again, in this context, defined as within the next 6 months. At this point, people recognize that their behavior may be problematic, and a more thoughtful and practical consideration of the pros and cons of changing the behavior does start to take place, with equal emphasis placed on both. However, even with this recognition, people may still feel ambivalent toward changing their behavior. Once people enter the third stage, the preparation stage, they are ready to begin to take action within the next 30 days. We see them beginning to take small steps towards the behavior change, and they believe changing their behavior can lead to a healthier life. Then we enter action. In this stage, people have recently changed their behavior, again here within the last 6 months, and intend to keep moving forward with that behavior change. Typically, they exhibit this by modifying their problem behavior and or acquiring new healthy behaviors. So in this model, maintenance then represents when people have sustained the behavior change for a while, defined as more than 6 months, and intend to maintain this behavior change going forward. When in this stage, individuals work actively to prevent relapse to earlier stages. Like I alluded to earlier, termination is rarely reached, and people tend to stay in the maintenance stage, so the termination stage is often not considered in health contexts. When it is included, though, it encompasses people who have no desire to return to their unhealthy behaviors and are sure they will not relapse. Relapse, the loss of this positive behavior change, is not listed in the 5 stages themselves, but it is recognized as a process that occurs within the model. Now that we have a good sense of what each stage entails, I want to discuss how you can successfully interact with yourself at each stage to support your progress to the next one. All of these stage-specific strategies will be best implemented by engaging in active reflection. To do this, you may want to consider journaling your thoughts or speaking out loud to an audio recording device. In pre-contemplation, your primary objective is to explore whether you have any doubt regarding your belief that change is truly not worthwhile. Remember that in this stage, individuals have no intention to take action anytime soon and do not recognize their behavior or choice as problematic. In order to help yourself move from this starting point to contemplation, we need to enhance your understanding of your current behavior, especially the associated risks and problems. This is prompted through awareness building and increased access to information. To highlight this, let's consider for a moment a person who is experiencing medication overuse headaches due to their excessive use of Excedrin, over-the-counter migraine medication. Ideally, we would want to support this patient in discontinuing the use of this medication in order to resolve this issue. However, this person might not be very receptive to this notion, given that many people in the general public associate Excedrin with less pain. If implementing this model and associated strategies in their own life, they may ask themselves, what is the impact of my current behavior? Or am I certain that making change is not in my best interest because my doctor keeps suggesting this? This person may also decide to pursue access to information on medication overuse headaches to learn more about this phenomenon and begin to elicit doubt regarding their current actions. The perceived positives of Excedrin to the potential negatives or outcomes or risks might be a process they work through. Typically, people do respond better to this self-questioning approach rather than simple advice giving, or instead trying to force themselves to follow rules without engaging with autonomous motivation, without engaging while truly believing it's the best thing for them to do. When a person enters the contemplation stage, meaning that they have intention to take action in the near future and are aware that a problem exists, but have yet to commit to taking action, then the objectives and strategies are a little bit different. Now, you are still early in the process of change, but you are just a little bit more receptive. Here, we want to build awareness by highlighting the costs associated with not changing while emphasizing the benefits of change. I think of this as sort of being a salesperson. You're pitching to yourself why the change you're considering might be a good deal, maybe an even better deal than what you're currently doing. Here, your goal is also to foster a sense of self-efficacy. The change that you are facing can often seem intimidating or frightening. You have the ability to prompt change by helping yourself believe that you can change. This simple shift can be especially powerful. The questions at the bottom of the slide are a good example of how you can help yourself recognize your strengths and your past experiences of successfully achieving change. If you struggle to answer the last question, it can be helpful to ask a loved one or a close friend for their thoughts. We're often most critical of ourselves, and people outside of us can help us identify those things. Lastly, in contemplation, you want to support yourself in getting specific with regards to how you will know you are ready to change, when it's your moment to move to that next stage. Identifying signs of readiness is valuable in making a plan and also fostering those feelings of self-efficacy, the belief that you can change. Then, when you're experiencing the preparation stage, things are actually relatively simple. Here, you want to focus on determining the actions required to make the change. This is your primary aim in this stage. We want to get specific here and identify an achievable goal, anticipate obstacles, and develop a plan for how to overcome them and connect to helpful resources. The questions above depict how the person in the example of medication overuse headache that I gave before might engage in this process. In preparation to move to the action stage, a thorough reflection on what you need to support your progress, what you're trying to achieve, and what resources you have at your disposal is excellent scaffolding to effective motivation and future change. Then we enter action. This is the stage where you support yourself in explicitly making the change. You've gotten started, you've taken active steps to prepare. While being in the last stage, now we want to fully jump in and determine how we can maintain engagement in the change process. You can do this by asking yourself the questions listed, and these act to foster and maintain autonomous motivation by clear acknowledgement of the benefits, advanced planning of how to overcome future obstacles, and by building a connection to your proven ability to change. When you hit maintenance, this is a really strong sign that you've successfully moved through the earlier stages, built awareness through the objectives and questions discussed, and are well poised to maintain your adaptive change. Your objectives during the maintenance stage build upon your actions during the action stage. You want to reflect on and highlight the progress that you have made. This serves to bolster motivation and again contribute to those feelings of self-efficacy. Both of these things support ongoing effort and greater chance of success. Motivation can be fleeting, so we really do our best here to keep ourselves connected to the value of change and the importance of continuing by highlighting the benefits, noting our goals and personal values, fostering the ongoing process of autonomous motivation rather than connecting to controlled motivation. A brief note on relapse. Relapse is tough. It's really hard to recognize that you are moving in the right direction, applying helpful pain coping strategies, maybe getting some of your old life back, but now you've stopped. When you experience relapse, try to remind yourself that this is a normal part of the process of change. The process of change is not linear, but very zigzaggy. Here, we want to implement questions and strategies similar to the ones we discussed during the earlier stages of change, depending on what stage you are in now. So in other words, if you notice that you're experiencing a relapse to an earlier stage, You would want to reference the initial questions we discussed for that stage to try and help yourself reconnect with the change process and move forward through the model. In general, you want to once again engage in reflection and attempt to highlight the negative impact of stopping the change, note the potential benefits of starting again, enhance your motivation, bolster those feelings of self-efficacy, and plan ahead for obstacles. Now that we've talked about the stage-specific objectives and questions that you can use to enhance motivation and prompt change, I'd like to focus on these 3 quick tips that are highly effective in supporting what was discussed earlier and fostering your autonomous motivation. Often, when we're faced with the need to make a significant change, we start to list off all the reasons why we can't change. You might say something like, I just can't do my PT exercises because I feel overwhelmed by them and I think I look awkward. This is sustained talk. Sustained talk increases our focus on the obstacles and in turn actually sustains the behavior we want to change. You may be engaging in sustained talk if you often feel stuck, hopeless, and like your motivation has all disappeared. Instead, we want to engage in change talk. This prompts the opposite of sustained talk. Change talk involves compassionately asking yourself questions to identify the discrepancy between your current behavior and the change you're aspiring to, while directing your focus towards the opportunities you may have to change rather than the obstacles. The language we use is so important, and this quick tip can instantly improve motivation by changing the narrative and redirecting attention. We see some of the question examples listed on the slide. Asking yourself questions like, when might I be able to engage in gentle exercise? Would prioritizing exercise in the morning be more in line with my goal of increased functioning, etc., really help to explore opportunity and engage in that process of change talk. This shift in mindset, noticing the opportunity rather than the obstacles, can be very powerful in increasing not only motivation, but also that feeling of self-efficacy. The second strategy is really great to implement when you notice your motivation to engage in the change process is low. We know that there are 3 key ingredients of change: importance, confidence, and energy. The trans-theoretical model of change and the objectives we discussed to address each of these components, they're addressed through the model, all of the components here. But I like this strategy because it's really excellent when you want to quickly investigate what might be the reason for your low motivation. I typically draw 3 continuums like the one depicted on the slide, using 0 and 10 as anchors. And then you want to rate the importance of the change, your confidence in your ability to make the change, and lastly, the energy or the resources you have available for this change. 10 being optimal, 0 being absolutely none. For maximum probability of change, all elements should be greater or equal to 7. From there, you'll want to notice which of your scores are lower than 7, which gives you a good indicator of where to focus your attention. You will then want to engage in reflection and this awareness building process to understand how you can increase your scores. This might look like the questions above, for example. How can this change become more important to me? Which may prompt reflection regarding your larger values or your long-term goals and why this change is so key. We also want to ensure that we incorporate the first tip, the tip of change talk, rather than sustained talk. We can do this by exploring what we've done to accomplish our current scores and set ourselves up for idea generation rather than focusing on what we've done wrong or the obstacles that continue to exist. Lastly, when trying to engage in change or motivate change, the potential of couching your goals and change behavior within the larger context of your values really cannot be underestimated. Values are the beliefs that motivate people to act one way or another. They serve as a guide for human behavior. I think of values as each person's unique true north. They offer us a sense of direction and tell us where we should be heading. To identify your values, you'll want to ask yourself, what is most important to me? This can be something or someone, even an abstract concept. This may be learning, community, success, or family. If you're having a difficult time generating values just based on that question alone, it can be really helpful to review a list of common values or flip through value cards to identify your top 3 to 5. Both of these things are accessible if you just Google a values list or values cards. You might notice a tendency to think many things apply, and that's totally fine. It can be helpful to go through the list once, cross everything off that does not apply to you, look what you have left, and then identify from there what your top 3 to 5 are. That's sort of an appropriate amount of values to sort of wrangle and move towards at once. Most people find that living in line with their values significantly enhances their well-being. With a chronic pain experience, values will allow you to contextualize your efforts to change, increase your autonomous motivation, and foster a sense of purpose. If you'd like to learn more about motivation, the process of change, or the trans-theoretical model of change, I would recommend the following books. Why We Do What We Do, the one on the left, is a fascinating and easy read written by Dr. Edward Deci, one of the co-developers of self-determination theory. And it offers wonderful guidance on understanding and engaging your self-motivation, harnessing autonomous motivation. Changing for Good by Dr. Prochaska and colleagues focuses on the trans-theoretical model of change. It was this team who developed it, and guides you on how to implement this construct into your day-to-day life. Lastly, Drive by Daniel Pink is an insightful self-help book that considers a number of surprising truths about motivation and is also an interesting read. I'll end with this quote from Edmund Hillary, who was one of the first people to summit Mount Everest. I think it eloquently highlights how we often have a tendency to focus on the seemingly unsurmountable obstacles in our way, in his case, the challenges of the world's highest mountain, while we underestimate the role of ourselves and our mindset. I'd like to think that Mr. Hillary might have thought that harnessing his autonomous motivation may have been part of him conquering himself and achieving this noteworthy accomplishment. I also hope that the information shared in today's talk might support you in learning to conquer your own inner obstacles, capture your autonomous motivation for change, and summit the mountains in your life. Thank you all. I'm happy to take questions through the Q&A. I think Dr. Jones is going to read them out. And on the next slide, we have additional resources here at the clinic that are things that you can ask your pain management provider about for a referral if you're interested.